Okay, just finished my first week of my second clinical rotation in Oak Park Heights, Minnesota at the Boutwells Landing skilled nursing facility, and things are going pretty well so far. The PT I'm working with is pretty excited to shake up the routine, or so she says, and it seems like patients are pretty excited as well. My days have been very busy. I wasn't sure if there would be much structure to the days or if it would be kind of like acute care where things are just crazy and all over, and that is the case. We start with a day plan, but if residents are busy or tired or not in the mood, things change around, but we get things done. Some of the things I've been seeing, kind of all over the place. Right now we have quite a few patients that have had strokes, which I guess is not typical. Normally there's more variety, but it's kind of the main thing right now. Some other diagnoses are orthopedic injuries, some chronic conditions such as MS exacerbations, sort of along those lines. I'm excited to see what things come through the door over the next few weeks. Exciting things with the live patient interaction. I have really enjoyed seeing live real patients demonstrate some things we've learned about over the last 2 years. And so seeing strokes, whether they've happened on the left or right side, and some of the commonalities that come with each of those strokes, it has pretty much lined up with what our textbooks have said. But any patient with a stroke is an individual and nothing is common. So seeing things change and sort of follow the books has been good. A new topic that I was not expecting is documentation. They do not utilize SOAP note format here. Instead, they use SOAR formatting, which stands for Scale, Outcome, Alter, and Reflect. And so that has been a learning curve, but a good learning curve. I think I'm getting a handle of it, at least for the day-to-day. We'll see where things start to go with evaluations. It's also definitely a new population for me. And so specifically working with different cognition levels, whether that's a lower cognition from the get-go, or if they have dementia or other diagnoses. And then hearing level has been interesting to work with. Not all patients choose to put their hearing aids in, or they forget. And so I've got a pretty good projecting voice, but remembering to turn that back down for some patients and bring the noise up without transferring into baby talk has been a good skill to work on, and changed after day one. So things have been good there. In general, it's been good for me to work with an unfamiliar population. It's been fun applying some of the same general conditions, orthopedic conditions of the back primarily is what I've seen. Comparing those from a 40-year-old I've seen in clinic to 85-year-old has pretty different focuses or progressions of care. Other enjoyable things have been interacting with elderly patients and learning about their medical history through time, but also their personal history. It seems to make the appointment a lot more enjoyable for myself, but mainly the patient, if I can ask them about their prior line of work or their kids or what they focus on their day-to-day. That's been really pleasant, and my CI has really enjoyed having another source of interaction with all of the patient interactions or appointments. For the rest of this clinical, we've got 7 weeks left, so about 2 months. I'm really excited to practice my verbal skills, specifically my description of tasks with this patient population. This week I told a patient to squeeze the front of their leg, so the quad musculature, to straighten their leg. And instead of straightening the leg, so squeezing the muscle, they squeezed the muscle with their hand. So working on different ways to describe tasks will be good. Then getting into some planning for interactions with patients, that'll be a nice thing to do. So planning progressions and allowing for enough time to do so. Things take longer than they do with young individuals while you're in a skilled nursing facility, finding that out. And then becoming overall more independent with the patients and progression and getting into the assessment. We haven't done that so much yet, or the evaluation, which I'm looking forward to. Really getting through a thorough medical history, finding the important aspects of their care and their goals with therapy and where they're going to go after the skilled nursing facility will be a good thing to work on. So I'm quite excited for the next 7 weeks. We'll see where things go.